You were on the like the warehouse, the outside but the like that would you get it all. So do you want to have be a better?
I've got 3 minutes.
Figure it out.
Thank you, Sheriff. Yeah, that would be awesome.
Actually, still do kick out.
Yes.
One everyone time they take their seats, please. Thank you. Okay, I would like to call the meeting to order, please.
Me gustaría llamar la junta, comenzar. Like to ask the interpreters if they would kindly give us the guidelines in English and in Spanish for the interpretation services.
Buenas tardes. Para aquellos que gusten escuchar esta junta en español, vamos a tener interpretación simultánea. Solo tienen que ir al globito que está ahí en la pantalla y escoger el idioma de su preferencia, aunque sean bilingües. We're going to have simultaneous interpretation, so if you can please select on the globe on your screen the language of your preference, even if you're bilingual. Thank you.
Thank you. Thank you very much. Next, I would like to see if we can do roll call and introductions, and BHAB members, when you answer for your roll call, would you kindly give us the committee that you are now serving on and also the district in which you serve? And I'm going to ask Elizabeth Stone if she would please take over the secretary's role today and call the court. Thank you.
Thanks, Janice. Claudia Alman.
Here, District 1 Prevention Committee.
Soledad Barragán.
I'm here, Soledad Barragán, representando el Distrito 5.
Nancy Borchard.
Nancy Porter, I serve in District 3, and I serve on the Adult Committee.
Jane Brooking. Kevin Clarici. James Espinosa.
Espinosa, District 4, veteran representative. I'm currently considering prevention. I'm not yet on the next meeting.
Genevieve Flores Taro. Cheryl Hyson.
Good afternoon, District 1, and I'm on the Youth and Family Committee.
CJ Keaton.
Good afternoon, CJ Keaton, District 2, a member of the TAG Committee.
Professor Matthew Weir.
Good morning, Matt Levere representing the Board of Supervisors.
Zoe Mevenko. Diane McKay.
Diane has let us know that she's on her way, but she's going to be a little bit late.
Jennifer Morrison. Sean Pusey.
Sean Pusey, Law Enforcement Representative and the Adult Services Committee.
Dahlia Robkin. Michael Rodriguez.
Good afternoon, Michael Rodriguez, appointee from District 5. I'm on adult services, children and family, and disparities reduction.
Paramount.
And Chair Mary. And we have
Elizabeth Stone, that's me. I'm second vice chair of the executive committee. I was appointed by Linda Parks to give voice to some of the experience of people who've been diagnosed with need services. As I have direct lived experience in that capacity, I also chair the TAG committee. Chris Tejeda. Marlene Flores.
Good afternoon, representing District 5 and Reducing Disparities Committee.
Liz Warren. Dennis Gardner.
Here, Janice Gardner, Chair of the Behavioral Health Advisory Board and the Prevention Committee, and I was appointed by Supervisor Law.
Diane McKay.
Yes.
here.
Quick intro, please.
District and what can I do right? From Area 2, appointed by Jeff Gorell, and I am on the Youth and Family Services Committee.
So 13 out of 21, we're good. Quorum.
Thank you. Thank you, Elizabeth. I did want to mention that there's some cookies in the background back over there, so if anyone would like to
Hot
have a little
cocoa.
snack. Yes.
Hot cocoa.
No hot cocoa, I'm sorry. But at least we can get on sugar. Thank you. Okay, Are there, Jackie, are there any requests for emergency circumstances or, just cause? All right, answering no, great. May I have a motion to approve the agenda, please, for today's meeting?
So moved.
Second,
All right, are there any changes, requests, or comments? Hearing none, may I have roll call, please? Can we do roll call, please, Elizabeth?
So to approve the agenda as written, Claudia Armand,
Yes.
Soledad Barragan,
Yes.
Nancy Borchard,
Yes.
James Espinosa,
Yes.
Cheryl Hyten,
Yes.
CJ Keating,
Yes.
Supervisor Matt Levere,
Yes.
Diane McKay. Is it Sergeant?
Yes.
Yeah. Sergeant Sean Keating,
Yes.
Michael Rodriguez,
yes.
me, yes, Marlene Torres,
Yes.
and Janice Gardner.
Yes.
The motion passes as written.
Thank you. Thank you. May I have a motion to approve November 20th, 2023 minutes, please?
After the second.
May I have a motion? Oh, so moved. Okay. Is there a second?
Second.
Are there any changes, requests, or discussion about the minutes?
On page 3 of our minutes under item 9, it's about the public hearing. One of the things that was mentioned is, it says Johnny Tremblay, Vice Mayor of City Council, and real is Tony Tremblay. And also it said he wanted to seek additional information on the inpatient structures being used. I think he was talking about the proposed construction that might be happening within the city of Camarillo. Sorry, this worded kind of wrong, like, say to look at it more closely.
Thank you, Nancy and Jackie, you have those corrections? Okay, thank you very much. All right. May we have a roll call, please, to approve the
Janice, the maker of the motion and the second had to accept the amendment.
Thank you for the reminder, yes. With the person that made the motion and the person who made the second, do you approve the changes?
Yes. Yes.
Okay, now, thank you. May we have roll call, please, as amended?
Okay, so this is a vote to approve the minutes as amended. Claudia Armand,
Abstain, I was absent.
Soledad Barragan,
Me abstengo porque también estuve ausente.
Nancy Borchard, that was the translation.
I know, yeah.
So that, yeah, sorry.
Yes.
So yes,
Yes.
thank you. James Espinosa,
Yes.
Cheryl Hyten,
Yes.
CJ Keating,
Abstain, I was not here.
Yes.
okay. Thank you, Supervisor Matt. Diane McKay,
Yes.
Sergeant Sean Pusey,
Yes.
Michael Rodriguez,
Abstain, I wasn't present.
me abstain, Marlene Torres,
Abstain, I was absent.
and Janice Gardner.
Yes.
So motion passes as amended because abstains, so we have a quorum and nobody voted against, so there's still a majority of people approving, yeah.
Okay, that's fine, we have the consensus, all right. Minutes are approved as amended, thank you very much, Elizabeth. All right, next we have public comments, 3 minutes per speaker. Are there any public comments from anyone? Is there anyone online? Sorry.
So do you want me to mention the written public comment?
Yes.
So there was a 7-page written public comment submitted by Greg Friedman, who's the dad of a young woman who died by suicide after early discharge from Vista Del Mar. And it's 7 pages and there's 3 minutes. It is attached to the agenda package. And yeah, I've been asked to not read it and to ask people to take a look at it.
Thank you, Elizabeth. All right, next we have a recognition award for Scott Walker, the Ventura County Sheriff's Office. He is the grant coordinator for COSSUP, and he is a former CIT, I believe, director. Program administrator, and I'm going to go to the podium and ask our BHAB member and Mr. Walker to come up, please. James Espinosa.
With my honor and pleasure to present an award to my friend and fellow CIT man, Scott Walker. I met him about 2009 and we've been friends ever since. It started as a friendship that started through the county crisis intervention team training. I've personally witnessed Scott conduct dozens of training courses throughout the last almost 15 years. So what I like to do is read the citation that we've prepared for him. Well, Scott Walker served at the Ventura County Sheriff's Office as a crisis intervention team program assistant and program administrator from February 2009 to January 2023. Over Scott's nearly 15 years with the VCSO CIT program, he played an integral role in training upwards of 1,200 sworn police officers and dispatchers over the course of approximately 24 CIT Academy courses. Those he trained ranged from new Academy graduates to seasoned veteran officers and deputies. Scott's management ability and style were vital in holding dozens of successful 40-hour Ventura County CIT Academy courses over his tenure with the program. The CIT program is a national model. CIT teaches sworn officers and dispatchers about mental health conditions and appropriate responses to people in crisis. Undoubtedly, Scott's time with the Ventura County CIT program has helped save lives and improve police response to those in mental health crisis. Scott's efforts and passion in the mental health field paid dividends for all who attended the VCSO CIT Academy. Scott was called upon by countless officers from around Ventura County. Scott was consulted for information, advice, and or strategies to best support a person in crisis and helped obtain the services they needed. He developed excellent working relationships, and in addition to being a reliable and trusted source of information professionally, he was often referred to as a friend. In addition to teaching numerous officers, deputies, and dispatchers, Scott has often gone out of his way to attend mental health awareness events, seminars, and to promote positive responses to persons in crisis. It is with great pleasure that the Ventura County Behavioral Health Advisory Board, all of us, commend and recognize Scott Walker for his numerous years of dedicated, exemplary quality of service, knowledge, and expertise to the people of Ventura County. Scott is currently employed by the Ventura County's Sheriff's Office as the Comprehensive Opioid Stimulant Substance Use Program, COSO, Grant Coordinator at the Ventura County Jail, assisting incarcerated persons fight addiction. This was presented on this day, the 18th day of December in 2023.
And now we have Supervisor Levere and Catherine Barrett from Supervisor Department's office who have other commendation awards to present to Mr. Walker.
Thank you. And the proclamation that we have here from the Board of Supervisors, the language mirrors largely what the stress that also just read, but we thought, given the recognition to BHAB, that we on the Board of Supervisors wanted to similarly recognize you for just the incredibly important work that you do, the training you provided, the difference you've made in law enforcement and how we respond to crisis It's been nothing but excellent. We wanted, as a board of supervisors, to provide you this proclamation as well, honoring your years of critically important hard work. So thank you.
We also have some other proclamations of recognition. So Congresswoman Julia Brownlee, she couldn't be here, but she also wanted to, on this occasion, recognize you for your outstanding leadership, your remarkable service, and your unwavering commitment to the health and safety and well-being of the people of Ventura County. So this is a certificate from her. So she just wanted to thank you so much. Congratulations. And then also, Assemblymember Jackie Irwin has known you personally, so you'll be getting another certificate from her, and she wanted to also recognize you and thank you again for everything that you're doing. So it's so important. We just want to continue and thank you if there's anything you can also do to help. And the Neighborhood Advisory Board, I know James, he personally reached out and just reading what you're doing, Supervisor Parker. We just wanted to, really, this is so important, and all the workers can be able to reach out and touch everybody within our community is so important. So I love the support you have here and your wife being here. We have to recognize that. So thank you once again. So congratulations.
I want to thank the BHAB and all the folks here that I didn't realize it was getting so many awards today. Thank you very much. Arguably my best CIT Academy student I've ever achieved, just when I was first CIT Officer of the Year. So I owe a lot to you on this. Thank you. I want to thank 3 people publicly that I never had a chance to ever thank. There's a lot of people I'd like to thank, and probably 3,500 people on my phone that I could thank, that I could show you, but I just want to select 3 if I could. I have a lot of my command staff here today. My former CIT captain and the assistant sheriff of detention services, who I now work for, is Shane Matthews, who is here in the room. My formal and informal mentor for several years, Cecil Argue, is here in the back. And most importantly, my wife Heather, who is sitting right there. CIT is quite a time commitment in doing that, and those 3,500 contacts do occasionally call and ask for favors, and usually they're at dinner time or days off or in the evenings or on vacation, including, and I took the phone, sometimes took a call or the emails, much to my wife's pleasure, but she was very patient and allowed me, and she knew that we were ultimately doing something to help someone else so they could help a community member in need, and so I appreciate that. And I appreciate anyone here who ever took my call after hours, because I'm sure I've called or emailed many of you for something that we needed to help someone. So thank you very much.
Congratulations.
Yes, and Heather, thank you so much for lending Scott to us for so many years. I'm sure the jail really benefits from that, and to commend staff from the Sheriff's Department, thank you for being here to support Scott as well.
Thank you, James. Are there any public comments on this item? Okay, go ahead, Elizabeth.
Scott, I've always really appreciated your openness to conversation and listening to the peer perspective and your continued sharing of resources. And I really look forward to a very successful program in your new role.
Yes, please.
Hello, everybody. Shane Matthews, the Sheriff's Office. Shane Matthews, the Sheriff's Office. So, as Scott mentioned, I was in Camarillo and managed the CIT program when he was there. Scott has a decades-long footprint in CIT and really helped shape the way it is now. And one of the goals of CIT is not just awareness and training and connecting people with services, but it's also reducing uses of force. So how do you measure something you prevent, right? But I can tell you firsthand that the work that Scott does, he's very passionate about it. He oftentimes won't let things go. That's a good and bad quality sometimes. But he's personally invested in it. That's one of the things I appreciate about Scott so much, is that it really means something to him. So Scott, it's well deserved, and thank you for what you do.
Okay, yes, please, Michael.
Congratulations, Scott. I appreciate the times that we've collaborated together in order to get services and assistance to those who are in need for acutely symptomatic, and just realizing that, you know, together we can, law enforcement and people's office at times could work together to ensure that folks get the treatment that's appropriate to their needs at that time. So thank you.
I just wanted to say thank you to Scott for all of your years of service. Scott has continually gone over and above most of what most people would do to help the community in which we live. And Scott also would go to a lot of different events and certainly BHAB meetings, taking time away from, thank you very much for sharing him with us, his family, to, you know, to be present and to help those in need. And we just appreciate your ideas and all of the things that you've done and will continue to do. Thank you. Okay. All right, thank you very much. Our next item is our time certain presentation, which is an overview of legislation AB 531, SB 326, Proposition 1, and SB 43, and this will be presented by DCBH Acting Director, Dr. Loretta Dinnering. Thank you.
Good afternoon, everyone. Thank you. That's a mouthful of numbers and letters. So we will go ahead and get going. It's a lot of information here. I do not expect everyone to retain it at first pass, so feel free to ask questions once we get through the slides, and we'll have a nice discussion towards the end. Okay, next slide. So this was originally presented to the Board of Supervisors just last week or a couple weeks ago. But given the significant changes on the horizon, we wanted to ensure that everyone in the BHAB was aware. So the little disclaimer is that, you know, this is just information only. Obviously, the county and the department do not take positions one way or the other with ballot measures. This is just pure information related to the bills that are up for vote. Okay, so the first thing is just kind of a level set, as many on the BHAB are aware and in the public. The Behavioral Health Department has two main primary areas of responsibility. We are known as a plan, so the mental health plan and drug Medi-Cal organized delivery system plan on the substance use side. That's close to what most folks know as like your insurance arm. So we have functions and responsibilities related to plan services. And then we're also one of the types of counties that has a mix of provider networks that we do both contracted and directly operated. In some counties, they contract all of their services out. And in other counties, they operate all services, and then some like ours, most like ours, have a mix of county operated and then contracted services. And so under those responsibilities, we have major program areas that most of you are familiar with, our specialty mental health services under Medi-Cal, and then drug Medi-Cal is the equivalent on the SUD side, and then other funds that cover areas related to Mental Health Services Act, and then again, our managed care services. And that is what our new quality care division that we stood up last year carries out a lot of the managed care services. So that may be a new bullet for some folks. Okay, next slide. So as many of you are aware, we have a lot of changes coming to the system and have already been underway for the last several years. So CalAIM really kicked off, the initial, concept for CalAIM was really formulated back in 2019. It was really delayed due to COVID in 2020, so it was pushed out about a year. But we have really been actively in our system transformation under CalAIM since early 2021. So there's been a lot of work that has already happened on the behavioral health side under CalAIM, and one of the most largest changes that just happened was our payment reform, which was in July of this year. And so that's when we launched our new electronic health record, Smart Care. And so that was a huge transformation in the way that we build the state, the way we're reimbursed, and our metrics and the way everything's tracked using the new EHR. And so we are underway and have transitioned relatively smoothly considering what a heavy lift it is to change electronic health records systems. And so we are moving through that pretty nicely. We are still also working through the behavioral health quality improvement plan attached to CalAIM. We had a submission back in September, and so those are ongoing with the state. We have a number of initiatives going live early this year, next year, some of it contingent on MHSA reform. But under CalAIM, the latest will be the Medi-Cal mobile crisis services, which go live at the end of this month. And that really is a huge step in that currently mobile crises are not necessarily billed to Medi-Cal. Most counties fund using MHSA or other funds. Now under CalAIM, mobile crisis services are Medi-Cal benefit. So we're able to bill Medi-Cal for those services. And this starts the kind of implementation road towards the 988 and the implementation there to have mobile crisis throughout all county systems by 2027. And so this is how the state is moving us in that direction. So we'll get into a lot of these, but I wanted to note also the last bullet, which is BH administrative integration. So that's full integration between mental health and substance use. Which is a pretty significant overhaul because that aligns all of our contractual and data requirements because they're currently two separate systems under specialty mental health and drug Medi-Cal. Are we good or should I keep going? Okay. The implementation of the integrated system will put us under a single contract with DHCS, a single payment structure, and aligned reporting requirements. So we are an early adopter county. So we will actually be going live in 2025, which means we've already started working directly with the state on all of the planning. And so we'll be one of those counties that gets to work with the state as we develop that out. Next slide. Okay, so today we want to talk about three major pieces of legislation. The first two will be combined on the March ballot. The first is AB 531, which is the Infrastructure Bond Act that is the measure that will allocate just over $6 billion for housing treatment, including acute psychiatric beds across the state. SB 326 is is currently known as the Mental Health Services Act, which will be repackaged as the Behavioral Health Services Act. It's the second component of the package that pretty much overhauls MHSA as it stands, and we'll get into what that means as we get through the slides. And then the last, which is something that has been very popular in the news very recently, is SB 43, which expands the definition of gravely disabled. Next slide. So again, there's more changes, AB 1412, which not everyone is probably as familiar with, but our justice partners definitely are, which augments some of the requirements for pretrial diversion program. And then the last piece, again, the significant changes with CalAIM, as I mentioned, a lot of that work has been going on for the past several years. And these are just specific to behavioral health systems. So what's on the screen here and in your packet. So you may hear more about CalAIM now because it is hitting other health delivery systems and primary care. There's a justice involved component now, but behavioral health has been in the middle of CalAIM since what feels like forever. So this is just a list of all of the things that we've already done and continuing to implement. Next slide. Okay, so getting back to AB 531, again, this is the housing piece where $4.4 billion will be allocated for the treatment beds, and then another $2 billion for supportive units, and add that about $1 billion is set aside for veterans housing. While some of this kind of will be outlined on the proposition as it stands, as far as, you know, exactly what it means, a lot of the definitions and, how the funds will be disseminated to the counties has not necessarily been worked out. So it's still unclear exactly what this will look like. But as it stands, this is how the funds will be allocated. Next slide. So in summary of what the reform will do is prioritize expanding treatment to include those with substance use disorders. So currently you can use MHSA funding for people with co-occurring SUD and mental health disorders. It's a little tricky on how you do it, but it's allowable. Under Prop 1, there will be basically an entire new population that's eligible, and that is folks with primary SUD. You don't have to have a mental health condition as well. There will also be ongoing resources for housing. You'll see in the upcoming slides, there's a new housing component, and so there will be a bucket just for housing. There's also going to be increased oversight and accountability for all mental health services and all SUD services. So regardless of payer source, so whether it's MHSA funds, realignment, block grant, mental health block grant, substance use block grant, or substance use block grant, it's been renamed. The accountability and transparency will impact all. So that's kind of related to MHSA, but it's actually broader than that. There are some other areas within the proposition that are more broad to behavioral health and not specific to just MHSA. So this bill is actually quite large as far as reform, which is great because then it kind of aligns all of the different programs and payer sources, regardless of where the funding originated. Next slide. So these are kind of maps of how things stand now and then where we see them going under the new buckets. So currently you can see that we have certain allocations in areas based on how the state outlines. So it's kind of hard to see, but we have our community services and supports. We have innovation, PEI. Most folks on the BHAB are very familiar with those buckets, and you see them in the 3-year plans and the annual updates. So under the new bill, there are kind of restructures as far as there is no more CSS, but there is a full service partnership gets pulled out, and that's currently in our CSS bucket now. FSP is its own standalone category now under the new model. There's also a new behavioral health systems and support services and supports, which includes PEI and what was innovations kind of there. The most striking is the housing component, which is now 30% standalone. And then you have of an actual increase of what the state takes off the top. So currently they take 5% off the top, and then 95% goes to counties. In the new model, they take 10% off the top. So there will definitely be some moving and shaping and shifting because there are new buckets, but no additional funds. So we have new populations to serve, but the funding doesn't necessarily increase. Next slide. So this is just a rough visual of our current budgeted use for MHSA. So you can see that the majority of our allocation is for CSS, and then we have PEI and innovations. And then again, in the new categories, this is our estimate, very rough estimate as to how they would function in these new categories. So as we get closer to things, once the, ballot goes to, or the measure goes to the ballot, and if it passes, then obviously much more intense, analysis will be done. We've already started all of the preliminary analysis as much as we can do, given that it's unknown right now. But once, if it passes, there will be more intense analysis, more, conversations with the state, and modeling as to what this will look like. Next slide. Again, I just wanted to emphasize that we have new focuses, so SUD and housing the SUD component is obviously very exciting because it's a population that we've always, wanted to serve using these funds, but haven't necessarily been able to with the current regulations. And then housing pieces that we do have some housing work that we do currently with MHSA, that this brings together an entire new bucket that allows for housing interventions for children and families, and then the populations listed in the slides, and then the different interventions that are outlined as well. Next slide. Again, it's important to kind of break out exactly, what is shifting. So 35% of the allocation needs to go to FSPs. So again, we will be doing analysis on what that actually means for us now, looking at our current utilization, estimating how much more would need to go into that bucket and the impact that that would have on other services, including outpatient treatment. There are inherent risks when you have to shift models like this. So we will be analyzing how many of our folks would meet the FSP level of care when it gets defined by the state, because that's currently undefined, like what it will mean to actually be in an FSP level of care, and then the impact that that would have on the remaining populations that would be served in outpatient or non-FSP levels of care. There is some flexibility. There was a lot of back and forth during the legislative season about, needing to have flexibilities because not every county has the same needs across the board. Not every county has populations that would necessarily warrant 35% of dollars being spent on the FSPs. And so, community support, or what we now call behavioral health services. So there was a lot of advocacy to have some sort of flexibility. So the state did allow that you can move up to 7% with a maximum of 14% to categories. Again, it's going to be defined as to like what that means and how much. But again, we just wanted to note that there is some flexibility there. And then the prevention programs, you can see that, again, some of that money that was taken off the top at the state level, the intent is to do some higher level universal prevention at the state level that they will be doing. And it's unknown exactly what that would look like and how that interfaces with county level prevention work, but that's what some of that funding is going towards. Next slide. Again, this is the new oversight accountability piece that I mentioned. So currently, MHSA kind of reports to two different entities. One is the Department of Healthcare Services. The other is the MHSOAC, which is the Mental Health Services Accountability Commission. They will be streamlining all of that to include a review of all behavioral health funding, as I noted, which again will help streamline regardless of payer source, and then allow for kind of independent accountability at the state level to make sure that there are universal standards being met. Next slide. Okay, next we want to get into SB 43, which has been in the news a lot recently. So this is a significant change to the state's involuntary conservatorship law under the involuntary conservatorship under the Landrum-Petras Short LPS Act. Again, it expands the definition of gravely disabled to allow for involuntary detention and conservatorships of individuals, which now includes severe substance use disorder or co-occurring disorder. Currently, severe or any SUD for that matter doesn't necessarily meet criteria for involuntary conservatorship, so this expansion will allow for that. It also expands the definition to include individuals who are unable to provide for their basic needs in medical care. The defining of medical care and, it needs to be done by a licensed professional. And so some of this we will talk about, what that actually means as far as what infrastructure, what resources need to be developed. As part of this, we are also being held to consider more, to less restrictive areas like AOT, our Assisted Outpatient Treatment and Care Act, before we get to this step. So it's kind of a process where this is the last resort, obviously, and the state wants to make sure that we're using all of our less restrictive means before we get to this point. Next slide. All right, so in order to do this, which our county, like 56 other counties, will be doing no later than January of 2026. Counties need time to develop new policies and procedures, workforce, treatment capacity. Again, this comes much like some of the new services under MHSA reform. This comes without any new funding or resources. So there will be significant work done to develop criteria, such as what a severe, like a clinical assessment determining what SUD, at what level of being you should be, considered for something like an involuntary treatment. There is no current standard for that clinically, and so that needs to be developed. We also need to develop protocols and procedures for designating individuals who can actually do those assessments, because the assessment currently does not exist, and so then we would have to have a whole process to do that training for staff in the same way we do like a 5150 training for clinicians now. Another huge piece that needs to be developed is the actual infrastructure. There are very few treatment settings across the state that have the capacity to serve folks with a complex medical SUD or mental health condition. And there are really no known places that can do like locked placement for severe SUD. That level of care doesn't actually really exist in California. So that would need to be developed, and there are a few different ways the state can do it. They haven't issued any guidance to this yet, but some of the things that have been proposed are either creating a new facility type or augmenting the regulations and licenses for existing mental health facility types, such as a mental health rehabilitation center like an MHRC or a psychiatric health facility, a PUF. But currently those types of facilities are unable to serve folks with like a severe SUD. So regulations and licensing would need to be augmented before this population would be able to go into that type of facility. Next slide. Again, some of the financial risk and impact. So this new law does not trigger any new funding. And so obviously if you're going from potentially serving, 1% of the population and potentially could be conserved at any point on the mental health side on the current state. So in a county as ours, such as ours, you're looking at up to 8,500 folks per year under the current statute. With this law, that is anticipated to go up to at least 10%, given the number of people who have a diagnosable substance use disorder. So in that way, using that very crude math, you're looking at up to 85,000 people who could now be eligible. And so that is, that's a lot of folks. And so that will require a lot of people, including additional public guardians, patients' rights advocates, clinicians, staffing who would be able to, go through that conservative process. So again, these are rough estimates. Again, we are currently analyzing internally, what this looks like for us based on our current numbers, based on what we are seeing, and, estimating based on our, what we see locally, what that would mean for us. Again, the funding is a huge question mark because our current drug Medi-Cal funding only covers up to 30 days. There are ways to continue if we meet medical necessity, but with our current regulations, on average, folks are supposed to have 30-day stays. So obviously, if someone's in a long-term involuntary hold situation, they're going to be there for longer than 30 days, and so the payment structure would need to be augmented to allow for that. Next slide. Again, some of the risks, there are question marks as to the role commercial insurance would play, in this. Currently, they, deny requests for reimbursements for a lot of things, including our mobile prices, our inpatient SUD treatment. So that's where it becomes critical that the Medi-Cal system, the drug Medi-Cal system, especially on the SUD side, be augmented to, pay for these services, even for those with private insurance, because often once they come in, they become ours. Even if they started with private insurance, eventually they end up in the Medi-Cal system. So the Medi-Cal billing needs to be updated as such. So that's to my second point. Involuntary long-term payment is not reimbursed through Medi-Cal or other payers. So we would need to adequately address that through humane treatment. And then the state would need to invest in more consistent and sustainable reimbursement for longer term SUD. And then the questions as to how this links with Behavioral Health Services Act reform and what that means there also needs to be worked out. Excellent. Okay, so we're at the questions period. So available to take any questions. I know there's a lot of information to digest, so.
All right, thank you, Dr. Dennering. We're going to be doing, going around the room, questions for Dr. Dennering, and I would appreciate it if you would ask one question at a time, and we will keep circling back to everyone to ask 2 or 3 or however many questions you may have as time allows. Okay, first we have Michael Rodriguez. Thank you.
Good afternoon, Dr. Dennering. So what capacity does the county have to go from 8,500 to 85,000, both from staff and facility?
Currently none. So that's where we are really looking at our current numbers. I can't give you any current numbers right now, but that's exactly what we're doing is we're looking at how much, looking at the number of folks are conserved under this current system, the number of staff at the public guardian's office and, the behavioral health system, and then modeling what that looks like potentially based on the utilization that we think we would be able to estimate using our, highest level of care on the SUD side and what that would look like. So that's some of the analysis that we're working on. We will also be starting a work group internally with the county that will be probably launching in January. We have a nice timeline that's made. There will be representation from public guardian, public defender, our partners, to start to plan this out and map this out, because there will be, including county council, there will be a lot of different folks that will need to kind of weigh in to look at our allocation need as a whole as a county, our resource needs, and some plans moving forward. So
Thank you.
mm-hmm.
Thank you, Dr. Jenner. I just wanted to say thank you so much for taking your time to present this presentation to us and to answer our questions and all the work that it took yourself and staff to do. Appreciate it very much. Okay. Claudia?
This is a very sobering presentation, but thank you so much. I just wanted to wrap my head around what it means for someone to have a standalone severe substance use disorder. And I know you said the criteria has not been developed, but help me envision the types of situations that might qualify for substance abuse.
That's a very good question. And that's where we, even on the clinical side, are still trying to define what that means. Because, we can ask any person who's been in this field for a long time, and even those who haven't, it's very, very rare that you would have someone with a standalone SUD that's significantly, that would impair them so significantly, they would rise to this level. Almost always they're gonna have a co-occurring mental health condition. So that's where we're really asking the state, help us with a clinical assessment to define that, because where's the research that shows what that even looks like? Because in practice, that's not necessarily what we see.
Who's next? Okay. Nancy, go ahead.
I'm wondering if those numbers about the 85,000 thing, I thought I heard you wrong, but I thought I was gonna ask you if I heard you right, and it is. Is that, I'm wondering, 8,500 that we now serve, is that to the mentally ill, or is that also with substance use? So I'm wondering if we haven't included the substance use that we do already in that number.
That's a great question. So those numbers are, if you're using like the prevalence data that SAMHSA defines, about 1% of the population has like a severe mental health condition that would meet criteria for conservatorship. So in a county of 850,000, 1% would be 8,500. 10%, according to SAMHSA, of folks have a significant severe substance use disorder. So with that, we would say about 85,000 residents have that. So that's where those numbers come from. That's not necessarily, to Michael's question, how many we see and how many folks come through our system necessarily. That's the data and the analysis that we're doing currently, looking at what prevalence rates are versus how many folks are actually coming through the system versus how much resource needs we're currently spending. And that's how we'll be able to extrapolate, you know, kind of what we see our needs will be moving forward.
Thank you.
Go ahead, Diane, and then Elizabeth. This kind of stuff terrifies me, coming from education where they just give you the same amount of money and tell you you need to serve more people, especially facing the deficit that we're facing in the state of California. So we have till, what was it, 2006 to fully implement this?
To 2026. Yeah, January 2026 is when SB 43, well, if not before, but by January 2026, we have to implement.
But that I'm reading this right to be terrified that we're just being asked to do more with less.
Yes.
Okay, Elizabeth, and then Cheryl.
Hi. So, it's slightly a comment, slightly a question. This entire reform thing really stems as a political response to the number of people that are unhoused. That in the public perception is mostly people living with severe mental illness. Many people would describe it as psychosis and exorbitant drug use, right? So a lot of, you know, and that's partly why that 30% is going to housing, right? And then at the last minute, the day of the final vote, they made it block facilities, right? So, but I also know, because I participate in a lot of meetings up in Santa Barbara, NAMI, the medical criteria is really important, which you haven't touched on. And I'm mentioning the intersection of those systems because we know that the largest group of people who are becoming unhoused are seniors. There's significant difficulty. Can't even, what's it, after 62, you can't get into a psych hospital because of medical concerns. They don't feel they're sufficient or something, right? So it's this kind of overlap. And I hear what you're saying about the substance use. Just our point in time data is 50% of people self-report having a serious substance use misuse, but only 25% report having a mental health concern. So it's kind of interesting how self-report at the point in time, which Alicia will be addressing later. So, you know, the concern also is seniors with a severe physical.
Thank you so much for bringing that. So that is an entirely separate but related issue that is kind of locked into SB 43. So separate from the behavioral health aspect, there is a pure medical component where folks who are medically compromised, whatever that means, because to your point, that has also not been defined, nor have they defined who would even be able to do that type of an assessment in like an emergency room. So many folks on the hospital side are also in support of the delay because they themselves need to define what that actually means to be medically compromised. They need to figure out what type of medical professional would be able to do that. And they don't have the resources as well on the medical side. So, and then it does get tricky as you get older on the psychiatric side. That's where you would require geriatric psychiatry, and there are very few places in California that even have that level of care. UCLA is our closest provider for 65 and up. So that is another really important piece. Thank you for pointing that out.
Okay, Cheryl.
You know, there's, you see a lot here, it's very complex, everything you're saying, which is good for us to know, we have some time to digest it. I guess I have two questions, I only asked one. In this, somewhere I've read, and I don't know it's where I've been reading about this, but the definition of gravely disabled, are they trying to change that definition of the state and make it more uniform so that every county uses the same criteria, and doesn't set the bar at different levels?
So that's what the bill does define. It expands the definition of gravely disabled, which is the same across the state. So it's already the same. So this just expands to add a new population, the severe SUD and the medically compromised.
But my experience, limited as it is as a clinician, is that not every county does apply it in the same way. So I'm just wondering if this is going to be an opportunity for maybe counties to kind of compare and the state to kind of get the best definitions. They're not there yet. Anyway, just to kind of.
No, that's a great point. I mean, as far as the enforcement and the definition, you know, that actually is not included in this. There have been some administrative changes at DHCS as far as LPS reporting. So they are trying to standardize reporting across the state and do more frequent reporting. And so there have been some behavioral health info notices that have come out in the last few months, or draft notices, nothing's final yet, that would overhaul the reporting. Because I think there are different collection methods across the state. So the quality of data that the state is getting is not necessarily consistent. And so that's kind of a related measure, but not included in this bill.
Okay, CJ, and then if anyone has a second question, please keep your hand raised, so I know. Okay, CJ.
Okay, thank you, Dr. Goodrain, for bringing all this information to our attention. Pardon me. But this is a political action that if it doesn't pass, these things will not be, you will not have to deal with this. So I'm just wondering, what is the alternative if these measures go?
So I think the alternative is, if the bill as it's written doesn't pass, I think there are administrative changes that the state will still pursue that don't require voter approval, that they will still do to some of the aspects. And so as we get closer to that time, and if it happens, I'm sure there will be lots of communication there from the state. But they're going to change as much as they can, even if, you know, the voter approved pieces do not go through.
Thank you. Okay, second questions, James and then Cheryl.
Right, so this is my personal question, but as the veteran representative of the board, I would keep it limited to veteran issues. So I have full disclosure to the board as well. I was asked by Jackie Irwin to be a supporter of this bill and be a signatory, so you may see my name on the ballot as a supporter. Just want you to know that I'm not here saying in support at this meeting, but full disclosure to my fellow board members. The other thing I wanted to ask, or the only thing I want to ask, is the 1.0445 billion that is set aside for veterans. Is there any sort of discussion from the top down as to how that will look for our county?
Great question, and no. The mechanism in which the dollars will be distributed has not necessarily been defined. There has been talk to use on the behavioral health, the BHAB, behavioral health continuum infrastructure kind of platform. There has been discussion to use that as a mechanism, but we're not sure. We've been told it's supposed to be non-competitive, that counties will get an allocation, but none of that's really been worked out. And to your point about the veterans piece, that's been a question mark as well, is how much, you know, should counties expect to receive and how will allocation actually be determined? We haven't received that information yet.
Okay, Cheryl.
Thank you.
On the conservatorships with this new category, so how many, I guess I'm a little concerned with that too, because how many conservatorships do we currently have? And I guess that's a difficult number to manage already. So adding what looks like a big number a potential conservatorships, what would that mean?
Yeah, so that's exactly what we're analyzing now, is the number that go through the PG currently based on their staffing, and then, you know, how that interfaces with behavioral health staffing. And then that's what we'll use kind of as our baseline to do some modeling to predict what this will look like with the new population.
And how many do we have currently?
So about 300?
We have 300 LPS and 300 probate.
Yeah, 300 LPS and 300 probate.
Okay, Elizabeth has a question and then Diane.
And then Nancy. Okay, so on the 4.4 billion, I understand it is about a lot about housing. But it seems like we're putting in housing at basically at the cost of prevention for a while, which, you know, may work for a little while, but what is this 1.5 billion will be specific to local government? That's it's actually on, I'm sorry, it's on slide number, it's where we start AB 531 Prop 1. There. I don't remember. I'm really truly young. I was just, okay, I'm not that slow. I just really don't have a number on mine. Oh, I see it. Okay, I wrote it over. Sorry. Page 10. Oh, so this is the sub allocation for local government. So this is the piece where I said that we're supposed to get that directly. We're not exactly sure how that will be calculated at the local level and what our allocation will actually be. So, and then just, sorry, just to follow up, this is like FTS in education, our number of heads. So are they just gonna put a cap on how many we can serve at some point when they run out of money? Well, what will effectively happen, because to shift some of the infrastructure dollars over, it will take away from programs if there's no new money added to the pot. And so essentially you will be capping yourself based on how much money is there and based on how much staffing you're able to you know, afford. So, yes, we get a workload reduction, and that's in fact caps how many you can serve. Thank you.
Okay, Nancy, did you have a? Oh, well, no, go ahead, Elizabeth, your hand is raised, and then Nancy.
In terms of like SB 326, the big Mental Services Act, a big pot of money, and we have it all figured out at the moment. You know, it could be better, it could be worse. But if nothing changes, if that bill doesn't pass, well, everything, it seems like the whole, you know, 3 legislation pieces are coming very strongly to Mental Health Services Act monies, because that's a big pot of money. If they're gonna shift it out of one place to the other place, are they still gonna do that no matter? I mean, I guess it's a piece of legislation that has passed, or it's gonna, we're asked to vote on. I'm confused at this. I know we're supposed to be voting on the, you know, $6 billion or whatever. But I kind of had the feeling that the other one was already a done deal.
Yeah, so SB 43, that's not a voter initiative. So what will be voted on is Prop 1, which is a combination of SB 326 and then AB 531, which are 2 separate kind of related measures that have just been put together for the purposes of the ballot.
Yeah. Thank you so much.
Okay, Elizabeth.
Okay, more like comments. Just in terms of the billing, the way that they're rolling out all this stuff is, and I'm so glad the department's finally going to be able to bill Medicare, right? And then have MOUs with commercial insurance. So a lot of the funding for this is not to like keep grabbing them into BSHA funding, but to be billing more and more for services. So it's helpful to keep that in mind. It kind of concerns me that, and I've asked about outcomes data multiple times. I would really like to see the department getting ahead of what might be coming down the pike in terms of what are important outcomes data, and start gearing up for that. We really don't know what's working. We don't have performance outcomes data. We have like how many people are enrolled, so we don't know what's working. So for example, it concerns me at FSP has education and supported employment programs, which we don't have, but we give parties, right? Because to me, that suggests we don't really think people might be capable of recovery, right? But we want to keep them entertained. So that's kind of concerning. So again, all of this is really, for me, as always, people know, it's the resources of working with people to make changes so their lives are more meaningful to them and they don't need the higher levels of care. So those are kind of my 3 points. Thank you for listening to that.
Thank you. Are there any final questions for Dr. Dennery? Anyone?
Yes.
All right.
Thank you.
Yeah, so I'll just make a couple of comments. So the director's report is included in your packet, in the interest of time, and we'll not go over everything, but there are 2 areas that I did want to highlight, that are not included in the report. The first is really related to this discussion that we've just been talking about. Tomorrow, there will be an item on the Board of Supervisors agenda related to the public guardian, and to gear up for a lot of what we're seeing here under SB 43 and CARE Act. There is an item on the agenda that proposes to do an administrative move of the public guardian's office from the Human Services Agency to the Healthcare Agency, and to align with the Behavioral Health Department. So that will be effective in February 18th. If that is approved tomorrow, so I just wanted to give folks a heads up. And there's another item related to, so that one's effective the 18th of February. And then the other one is, I just wanted to provide an update on this Del Mar. I went to the board on the 5th and recommended that we continue the extension. So they are still extended on a suspended, their LPS designation is continuous suspension. They're still in review. And so there's an item on the board tomorrow. I just wanted to make folks aware of payment for them. It's for prior year. So it's for fiscal year 22-23 for prior services. So it's not related to this current fiscal year because there is no contract. So I just want folks to know that. And then the other piece with the review, as we get farther in, I would like to invite either members of the BHAB or members of the public to participate in one area of the review where we talk about your experiences. And so if you have any with the organization. So that information on that process and how it will be rolling out is forthcoming, but I just wanted to make folks aware of that. And then at the time in which the review is complete, the documents related to the review will be released. So I just want to put that out there as well. So once we make that determination. So, any questions?
Sure. Thanks. In the review that you're doing, is all the things that we've gotten, I think it was in our packet this time where it showed the list of things that are, is that complete? Is that everything you are looking at? Is that the list?
No, there's more, there's more documentation that's in review based on the reinstatement packet that they were provided and have submitted materials for.
Okay, so I don't know if this is in there and maybe it's not even appropriate for me to ask, but you don't have to tell me, I'm just suggesting this. But one of the things I've been concerned about is their level of training, education for their people who are dealing directly either on discharge or even with the patients, and what the educational level is. I know people who work there who haven't had any formal behavioral health education, and there may be places that that's appropriate, but when you're doing discharge and you're working directly with clients, I would, as a clinician, it bothers me if I feel like people don't have the professional background and education to deal with some of it. That may be part of it, and that's great. That just would be my concern.
Thank you.
Thank you.
All right, that concludes my presentation and report. Thank you.
Thank you, Dr. Dennery. That's great. Okay. All right, future announcements. I wanted to mention one community announcement, and that was the winter event for clients from BCBH, which was the client and family event held on December 7th at the Elks Lodge in Oxnard. over 425 BCBH clients attended. So many that next year they are going to have to find a different venue. And I heard from someone that was there that there was music and dancing and entertainment and dinner. And also visitors from the North Pole. And that I just heard that it was a great time for clients. And I appreciate the fact that everyone was able to have a really good time and have music and dancing. And it sounded like, I wasn't able to go, but it sounded like a wonderful event. And that clients seem to really enjoy themselves, and I think that was a great thing, so appreciate that. In our community, it's nice to have people come together on that level. I also wanted to mention that community announcements during the chair's report or during the secretary's report is culled from numerous media sources, county organizations, contractors, providers, and CBOs, community-based organizations. And so when we do make announcements, these are some of the resources that we utilize. We have appointees to the Board of Supervisors represent, as we all know, we represent the community at large. So if only one person received help, learned about new housing, mental health or substance use treatment that might have been opened or added, or received education about saving a life with suicide or naloxone education prevention. I believe that those, it's worth 5 minutes of these announcements to go out to the board and to the community at large so that we can distribute information, send out flyers, and hear from our county partners and other partners about what is going on in the community and where we can get service. I also wanted to, in closing, wish everyone in the room a wonderful holiday season, a peaceful holiday season, a healthy holiday season, and I look forward to working with everyone in 2024. That's it for my chair announcements. Next, we have the secretary's report. Jennifer is not here today. Did you have anything to add, Elizabeth? The secretary's report? No. Okay. I did want to mention that there is one opening in Supervisor Levere's. Oh, sorry. Correll. Sorry, not Levere. She did like. No, there's no opening in Supervisor Levere's office. Yeah, Supervisor Correll. Can you have an update on that?
He thought he had someone, she actually talked to me and I didn't scare her away, but she just decided it was too much for her right now. So he's gonna keep her.
Okay. Thanks for the update, Diane. Appreciate that. All right, next we have VC Continuum of Care Point in Time Homeless Count announcements. And Alicia Morales McKinney is going to give us an update on that. And she's on Zoom. Hi, Alicia. Thank you for coming today.
Good afternoon, board members, members of the public. I'm Alicia Morales McKinney with the Ventura County Continuum of Care. I'm here to talk to you today about our upcoming point in time count. This is an annual survey that we do. Our upcoming count will occur on January 24th of 2024. As you may be aware, we are required to conduct a survey across all geographic areas of our community. We are funded by state and federal partners that require this count. So it's essential in our efforts that we conduct this count so that we can get a point in time, a glimpse of who is unsheltered in our community. The survey is anonymous and you can register. There is a flyer in your board packet. We're also asking that you share this flyer on your social media outlets, on your networking outlets. We are looking to have at minimum 500 volunteers. It takes a community effort to ensure that we get the information that we need. As I mentioned, it is helps with us obtaining future funding, whether it's state or federal. There will be live training mid-January 2024. When you register, you may select the jurisdiction that you are interested in counting in. There is also a bit of demographic information that we ask and some basic information so that we can ensure a best match can occur when you're going out to count. We do recommend that volunteers go out in pairs, and we try to do a matching process where maybe there's an experienced counter versus a new volunteer that hasn't counted before. One thing I will share is we are really working towards gathering surveys where we are engaging with our unhoused. So as I mentioned, we will be having live trainings mid-2024, and the registration portal, you can, once you register there, you will get information from your city lead. So thank you for having me here today, and you can reach our continuum of care at venturacoc@ventura.org if you're interested in volunteering or have any further questions. Thank you.
Thank you, Alicia. Are there any questions for Alicia? Go ahead, Elizabeth. Oh, did you? Oh, go ahead, Elizabeth.
I just really would like to emphasize how important it is that we get an accurate count. Should Prop 1 pass, 2 additional pieces of information will be included in how funding is allocated for the MHSA, BHSA, and one of them is a point-in-time count. So we really need to count to accurately count how many individuals there are. And this past year, there was a lot of kind of observational counts, so we don't actually know what people's needs are, right? So it's really important that I'd like to encourage people, if they feel comfortable, to volunteer and attend a training so that we can actually speak to people to learn what their needs are so that we're accurately using our resources. So, thanks. This is going to be, it's what the 30% money that they're putting into No Taste Like Home stuff is, so it's important. Thank you.
Thank you, Elizabeth. Nancy?
I have a question. Would peers be able to be a counter or go with a team member, a fellow peer? Is that okay?
So any individual over the age of 18 may register as a volunteer. So yeah.
Questions? Okay. Claudia, did you have a question? Okay, thank you. All right, next we have committee reports. The Youth and Family Committee, Kevin is not here today. Is there anyone from the Youth and Family Committee that would like to have any comments or give some comments about the meetings?
We had a meeting with a quorum. I wish I had the notes and the agenda with me, but I don't. It was a very light agenda, so let me see if I can find the agenda, and then I'll come back to you.
Thanks, Diane. Okay. Next is the Prevention Committee. The Prevention Committee received an educational and extremely well-received presentation from Bright. Bright is an organization it is a contractor with the county, and it stands for Building Resilience and Inclusion Through Engagement. And Bright is involved in multiple engagement and community outreach efforts with youth and parents within Ventura County. They conduct parent, student, and community presentations in both English and Spanish. They have training sessions which reach specialty populations. They're on social media, conduct classroom presentations. They have booths at resource and health fairs.
Bright is involved in the wellness centers and have over 2,000 plays of online learning activities. Some of the efforts of Bright include overdose prevention and education, addressing health disparities, LGBTQ plus efforts, mental health and suicide prevention efforts, marijuana harms prevention, naloxone education and success stories, underage drinking, reality parties for parents, youth videos. They create activities and multimedia projects. And this is all with the youth. They do their own, they produce and act in engagement videos that go out into the public, and when they speak to other youth about these subjects. Bright conducts presentations in schools, wellness centers, and for multiple coalitions and parents throughout Ventura County. In these efforts, Bright staff and youth speak, educate, and share their stories and videos with other youth and parents. If you're interested in knowing more about Bright or receiving educational information, please contact brite.link/signup or bright.link/educators, or you can contact me and I'll get you in contact with someone. And then Diane.
I'm getting there.
Sure, take your time, we've got time. Okay, how about if we go to board member comments and announcements? Okay, all right, are there any board member comments or announcements? Claudia?
During the secretary's report, you kept alluding to a vacancy in Supervisor Lavier's district, and I think you might have been remembering that I said that my term is coming to a close in a few months. I've served 2 3-year terms and I'm not going to be serving another, and I met with the supervisor a couple of months ago to notify him, and he indicated he would love to see a consumer. And so I've been putting out a few feelers, but if others have suggestions for potential candidates in Ventura and Ojai, please share those with Supervisor Levy. Thanks.
Thank you, Claudia. Sorry about that. I was referencing Supervisor Gorel's because I didn't want to make that announcement on your behalf, but thank you for that. So we will be very sad to lose you as a board member. You've been such an integral part of this board and the prevention committee and for so many years. And I know that you have a lot of other wonderful things that you're doing in your other vocation that you're involved. Do you want to just say what else you do other than your personal?
Well, I work for a foundation that supports advocacy and organizing in Santa Barbara and Ventura counties, but I'm also started an affordable housing advocacy group in the city of Ventura, and we're quite active with that. And then most recently, I helped start the 805 AdocuFund that provides support to undocumented immigrants in times of disasters. And so I'm on the board of that organization, and that increasingly has kept me very busy.
Yes, so thank you for your service to the community, to the BHAB, and to the community at large. Thank you so much for all the efforts that you make. And we appreciate you very much. I'm going to be sorry to lose you.
Okay, this agenda isn't helping me much. I mean, we had updates from the Youth and Family Division and Mental Health Services Act. And some innovations that were coming through. It's without those notes in the second part of it. I just apologize. I will have prepared to report next time, and Chris will let me know he's not going to be here. I'm Kevin, sorry.
That's okay. It was Kevin, but
yeah.
So I will reach out to Kevin and find out if he's going to be returning to us in January. So thank you for that attempt, Diane.
Yeah, I want to thank him. He brought me the agenda, just doesn't tell me much when he can't remember what the presentations were without them in front of me.
My brain's handled, and it seems I would like to see a mechanism, and I actually would have hoped the chair would have done this, where individuals know that they only have 3 minutes. So when comments or concerns are submitted, that there is an effort to outreach to the individual to inform them of that. So they may still submit a 7-page letter, but they also then have something that can be read within the 3-minute time frame that kind of highlights the main points. I think there's some concerning things that were raised in that letter. And the fact that due to the format and the time limit that wasn't aired is concerning to me, but mostly because of the process of democracy and inclusion, right? That I think everybody should at least hear. If we insist that the committees don't do a written report because everybody wants to hear it instead, I think the least we can do is ensure that there's a mechanism that the public knows that to be heard, they only have 3 minutes, and we support them in doing that. So I want to offer that.
I would like to reply to that, and thank you for your comments, Elizabeth. Individuals that this particular individual there was communication to this particular individual mentioning the 3-minute public comment process. So that's my comment. Okay, Michael, did you have a comment?
Yes.
You're back.
And I trust you. When oftentimes when I'm out and about and people find out that I'm a public defender and one of my areas is mental health, we inevitably will have a discussion on how so many greatly disabled folks are not being conserved and they're left out on the streets. And that there's too many due process and patient rights protections to protect their rights when they have a right to also be housed and to be treated. And while I agree that we should be doing everything we can to ensure that folks have access to treatment that's appropriate to their individual needs, when this legislation passed to expand the definition of grave disability, I think unfortunately too many people thought that this was going to be kind of like a silver bullet and going to solve a lot of these problems. And I've been saying this like a broken record over the last few years, is that we still have, the spigot is still the same size, meaning that we still have the same staffing and all these departments up and down the state, the same number of facilities. By expanding the demand, all we're doing is creating more of a bottleneck. And so it's important that, one, that we do get serious on investing on improving the behavioral health treatment infrastructure, and 2, on an individual basis, and I've also said this several times, is that we go to our elected or local elected officials, meaning city councils, and we advocate that we need local treatment options. What happens time and time again is that we have the county or other CBOs who are exploring treatment options in a community. Local neighborhood catches wind of it, and then it's killed. And what happens is that local elected officials don't understand or aren't getting enough input from each of us who live in these different communities that this is a priority for us. Outcomes are better when we have localized treatment. The research is very consistent on that. And so it's important that each and every one of us, instead of always pointing the finger that so-and-so's not doing this or they're not doing it, is that we take it upon ourselves to advocate for local treatment options. That's and it shouldn't just be confined primarily in Oxnard and Ventura. It needs to be out in the East County. We know that. And we hear folks complain that they don't have enough treatment options in Thousand Oaks, Simi Valley, Moorpark, but yet no one's contacting elected officials demanding that those local communities do something about it and be receptive and open their arms, or when the county, or CBOs, are exploring treatment options for their residents, that it's a priority so that they will have the political will to do something about it. Otherwise, we're gonna keep having the same discussion where we have too few beds, too few treatment options, too few staffing. Thank you.
Thanks, Michael. James?
I want to concur with Mr. Rodriguez here on that note. I just also want to remind some folks of a little bit of the history. In law enforcement, we've been dealing with police reform probably since the like 2000s, maybe 2010-ish. Started with AB 1109 in 2011, and Prop 47 passed and Prop 57. So we also lost some of those law enforcement tools that were used to house people or try to get people into treatment. So I would support the idea that we find ways to advocate with our politicians and individuals at state level.
Thank you. All right, Elizabeth?
Yeah, thank you so much for those comments, Michael and James. Some of you may know that I do outreach with some people that are have lived outside for a really long time, and a lot of people find challenging. And I'm able to build relationships with them, and it's actually quite heartbreaking when they trust me and there's no place for them to go, and I have to tell them to go sleep outside again. And there's one woman I'm actually extremely concerned about her, because this last time of feeling abandoned, she's like, okay, I'm gonna use until I die. Like literally using to kill herself. She's that hurt. A lot of people that are living outside really, really hurt. A lot of trauma. So totally, it's really frustrating. People say like, it's not this binary, like we're just abandoning people to die in the street, or like this right to like we have to force them in. There's ways to engage people, but every time you build a relationship and people trust you, and then they have no place to go, the window closes again and they're not going to trust you again. So when I'm talking about resources and services, that's kind of what I'm referring to. And just in terms of the numbers, during the past week, for some reason, I think I read it this weekend, but the CARE Act, the state anticipates all of that legislation and money to get across the entire state, 2,000 people. So there's a lot of announcements about things that are they need very small intended numbers of individuals that are going to be impacted, right? And so again, and we found out, I don't know if you guys read the article about the Home Key project in TO. Yes. And all those people that have been sitting in the Premier Inn and all this stuff, and now, the FEMA funding's ended for Project Room Key. The county's picking up that bill at Premier Inn, right? And so there's just a lot of, echoing everything, it's really advocating on the local level. And the final policy thing is in terms of tools, right? If a county has sufficient beds, and I think Reno, there was such a thing on TV, Reno has really housed another of their people. If there are sufficient beds for people that are unhoused, then legally people can be taken into custody. I'm going to say arrested, but so when we have the resources, it opens up so many other possibilities. And you guys are kind of sick of hearing me say it, but it's really personal to me. It really breaks my heart to get people to trust me.
Thank you, Elizabeth. Nancy?
Thank you, Michael. I was just actually going to mention that very same thing about we don't have the answers, but we can speak to our officials. And there are lots of reasons and roadblocks in the way of making housing available. It doesn't have to be the Taj Mahal, you know, we don't have to spend $400,000 on a one-bedroom apartment. That just doesn't make sense at all. So I think we have to, I agree with you that we need to advocate, in our public forums where we have perhaps a better chance of an impact. It's not like they were gonna change the state of California, but we can do our own little bit here. And, you know, that whole lack of, I was interested yesterday in the County Star newspaper, was an editorial piece about the final conclusion that we've known forever that we don't have enough beds. Shock of all, you know, really, we've been saying that over and over, and we kind of get this look like, well, yeah, you know, well, we had 38 beds, now we're, thank goodness for at least staffing our hospital that we do have and providing a few more beds, but we need a lot of beds, and we've been saying that for years and years and years, and you know, it's just nice to see it recognized, I guess, validated that we weren't just imagining that we need these things, and we're not anxious to throw people in the hospital, we're anxious to get people well. And so, anyway, I agree with you all that, and I take that responsibility on myself to appear and to write in the newspaper. I think it's important, and you can pay attention when you're writing, not as a voice of the Behavioral Health Advisory Board, but as a member of that board. I think it's okay to say that, qualify that you're not speaking for the board. But it matters because it shows a little bit that you know a slight bit about what you're talking about.
Thank you, Nancy. Go ahead, Diane.
I just want to say, you mentioned the Thousand Oaks thing, which you were talking about the Shangri-La, the money disappearing. I mean, that was Thousand Oaks, King City, Salinas, all those cities. And so we wonder sometimes what happens to the money. This was money that was supposed to be streamlined out there to a group that was totally either not vetted or whatever happened, but that, you know, that's millions of dollars that was gonna, you know, help people be, you know, become housed, that is now just gone.
Thanks, Diane. All right, thank you everyone for your board member comments. Very much appreciated everything everyone said. All right, next on the agenda are site visits, site visit resumption. I do have a note from Liz Warren. Just want to read it. Liz is the lead on a site visit with for the Mental Health Rehabilitation Center. And that is going to be on January 23rd. I'm going to go to that. I know that she asked other BHAB members if they wanted to join her.
Is that Horizon View?
Horizon View, yes. Yeah, thank you. And then it's in Camarillo, it's near the airport. Okay. Camarillo. And then let's see, the item B on old business, data notebook work group. She said that the data notebook process has begun. The department has the required information and will meet with Liz in early January to review the next steps. And the third item C, ombudsman. Liz says that she has put the ombudsman work group on hold until after the holidays. And that's it from her. All right, next, presentation requests. If you have any presentation requests, please email myself and CC Jackie. We have quite a few in the queue for the next few months, quite a few months actually. And depending on the availability of the presenters and the organization, we will have those presentations. Next is recognition award recommendations, and I believe, Nomi, were you going to take the lead on recognizing Kay Wilson Bolton?
Yes, where you are.
Okay, so please let us know when it's ready and what months Kay might be available to come to the BHAB and join us. Respect Kay very much. Kay does not only run the shelter in but she also was a BHAB member and a board officer in the shelter in Santa Paula. So we appreciate
her and her efforts throughout the county as well. Yes.
I'm very much, I've been very vocal, and I try to run a committee that I facilitate this way. The process is really important. And I was very surprised to see the list of future presentations, because once again, a decision was made at the executive committee a week ago that is different than what you've now presented to the board. We had scheduled things through February, and then we're going to meet at our next meeting with a calendar to prioritize things, but you've kind of got some things on here. So again, and I'll tell you, part of the reason that this is really important, because this, for me, as someone who's used services and is very aware of like kind of how peers experience things and studies show, this kind of leads, when people do things behind closed doors and things, it really leads to mistrust. So when a board that is meant to be an advisory board for a type of service where people are already maybe hesitant to engage is engaging in the same kind of behaviors that lead people to be not trusting, it's really concerning to me. So there's been this real pattern that I just have to, you know, ethically, I as an individual just need to state that, yes, thank you so much for giving us a printed list of the things in the queue, because we had to agree through February. And the way that it had been left is that the executive committee would together prioritize what was, yes. So I hope the minutes reflect it accurately, because this is just going on quite a lot. And it's, to me, as again, as I mentioned, it's just really concerning because, you know, that's exactly the kind of thing that, you know, we kind of call it crazy making behavior. Like we all saw this thing and then this other thing happened. So to me, it's disrespectful to the democratic process. It's not inclusive or collaborative, and it's just really concerning. All I'm going to say.
Thank you, Elizabeth. I did want to mention that the future presentations and the list of potential future presentations has been announced for many, many, many months. Jackie keeps the current list, and we had talked about this, and we have had requests from BHAB members. We did discuss it during the executive committee, but you know, this is no surprise. And I think that moving forward, we need to go ahead and book some of these requests, as our BHAB members have been requesting them for all these months. And so that is the reason for having them printed. And again, if you would like any changes, or there are any concerns or requests, further requests, you know, please let me know and CC Jackie. Again, I wanted to reiterate that any of these presentations are going to be scheduled depending on who the presenters are and their availability. So thank you very much for that. Okay.
Sorry, did you have a question?
Well, Valcourt has to be April also, right? Is it quarterly? I mean, there's just no problem.
Well, okay. Yeah, I'm in close touch with the Valcourt about how much time they need and when they need to present. So, all right. And then next would be any further recommendation awards. If anyone has any requests for a recommendation to that has worked with the BHAB, someone in the community or a staff member, we always want to recognize both community members and staff members for all of their hard work and collaboration with the BHAB. All right, next is contracts. Board of Supervisors approved agreements on November 7th, 2023. And that contract is with Amada Enterprises, First Amendment for Skilled Nursing Facility and Mental Health Services. Are there any questions or concern about that contract? It's already signed and it's been approved by the Board of Supervisors.
View Heights. View Heights.
All right, are there any public comments before we close the meeting? All right, well, thank you for your participation. Thank you for being here and have a wonderful holiday season, and we will see you in the new year. I did want to mention that Jackie very nicely put together the calendar for the advisory board meetings for 2024. It's in our packet, and there will be some changes for the general meeting, and please take a look at the calendar. Well, I'm sorry, yes, Jackie?
No, I'm sorry, the calendar is not included in the packet, but it will be sent out to everybody on the BHAB.
Okay, thank you, Jackie. We appreciate your efforts in this. There are quite a few holidays coming up and they do affect some of our meetings, so look for that. And thank you, Jackie, for putting that together. It's a lot of work. All right, and with that, we will adjourn the meeting.
I'll see you in January.
Continuation of our and then one is behind that is the children's. No, she doesn't. She works straight for God. She did, you know, the first one she did meet with a couple of agents, and she had one for a little bit, and she was able to read everything and read him, was always saying, thank you. Agents like shop it around or go with, you know, or they have. It's a good relationship. Well,